Dear students, we shall continue with nerves of the upper limb. There are 31 pairs of spinal nerves which emerges from the spinal cord. The spinal nerve transmits three types of fibers. First, we have efferent somatomotor or descending fibers, which transmit motor information from brain to muscles and innervate all muscles of our body. Second, we have afferent or ascending or somatosensory fibers, which transmit sensation from skin, like touch, pain, or temperature, from skin to brain. And the last one, third, are the sympathetic fibers, descending sympathetic fibers, which transmit impulse from brain to the smooth muscles in the wall of the blood vessels and smooth muscles under the skin. I will repeat. One spinal nerve transmits three types of fibers. First motor, second sensory, and third sympathetic fibers. After leaving the intervertebral foramen, the spinal nerve divides into dorsal or posterior branch and ventral or anterior branch. Both branches contain afferent and efferent fibers. The anterior branches together form the cervical plexus, brachial plexus, thoracic nerves, lumbar plexus, sacral plexus, and coccygeal plexus. The spinal nerve is formed from an ventral or anterior spinal root and a dorsal or posterior spinal root, which fuse and leave the vertebral canal through the intervertebral foramen. The ventral root consists of efferent or somatomotor fibers, and the dorsal root consists of afferent or somatosensory fibers. The dorsal root contains the dorsal or spinal ganglion, containing the cell bodies of the afferent nerves entering the spinal cord. The very short trunk of spinal nerve divides into four branches: anterior, posterior, meningeal, and communicans branches. Anterior branch innervates the anterior part of the trunk and limbs. Posterior branch innervates the back. Meningeal branch innervates the spinal dura mater, and communicans branch consists of white and gray communicans branches. White communicans branch is a branch of the spinal nerve going to the sympathetic ganglion and contains preganglionic and afferent fibers, which transmit signal to the other neurons and leave the ganglion as the gray communicans branch, interganglionic branches, or pass through the ganglion and continue as the splanchnic nerves, in Latin nervis splachnici. The somites are segmental axial structures of vertebrate embryos that give rise to vertebral column, ribs, skeletal muscles, and subcutaneous tissue. Each spinal nerve innervates one somite. One somite consists of skin, muscle, and bone. A myotome is a group of muscles which preserves its segmental innervation and therefore is innervated by one anterior branch of the spinal nerve. A dermatome is an area of skin innervated by a posterior root of a single spinal nerve. This is why the pain often spreads in strips. The muscles innervated from one spinal segment share the same embryological origin. Adjacent dermatomes may overlap but never cross the midline of the body. Dermatomes retain segmental organization of the thorax and abdomen and are arranged longitudinally along the long axis of the limbs. The nerve supply to the upper limb is derived from the brachial plexus. The plexus is formed by the anterior branches of the cervical spinal nerves, 5th, 6th, 7th, and 8th, and the first thoracic spinal nerve. The brachial plexus consists of four components: roots, trunks, divisions, and cords. The roots and trunks are located in the neck, divisions behind the clavicle, and the cords in the axilla or armpit. The 5 roots are constituted of anterior or ventral roots of the 5th, 6th, 7th, and 8th cervical spinal nerve and 1st thoracic spinal nerve. They are located in the neck, deep to the scalenus anterior muscle. The first branch of C5 root is dorsal scapular nerve, which penetrates the scalenus medius and follows the D branch of the transverse cervical artery. It innervates the levator scapulae and the rhomboid major and rhomboid minor muscles. The second branch of C5 fused together with the branch of the C6, C7 and form the long thoracic nerve, which provides motor innervation for the serratus anterior and travels with the lateral thoracic artery and vein on the lateral side of the thorax. Each brachial plexus root have an associated dermatome. You can see the skin area of innervation of C5, C6, C7, C8 and T1 spinal nerve. We have 3 trunks of brachial plexus. The trunks are formed as follows. The C5 and C6 roots join to form the upper trunk. The C7 root alone forms the middle trunk, and C8 and T1 roots join to form the lower trunk. They lie in the neck, occupying the cleft between scalenus medius behind and the scalenus anterior in front. The first branch of upper trunk is suprascapular nerve, which follows the suprascapular artery and veins towards the suprascapular notch. It passes underneath the superior transverse scapular ligament to reach the supraspinous and infraspinous fossa and innervates the supraspinatus and infraspinatus muscles and provides sensory innervation for part of the capsule of the shoulder joint. The second branch is subclavian nerve. It is a small nerve for the subclavius. The branches arising from roots and trunks are supraclavicular branches of brachial plexus. Each trunk divides into anterior and posterior divisions. They lie behind the clavicle. The trunks of the brachial plexus divide to form the cords. 3 posterior divisions form the posterior cord. 2 anterior divisions form the lateral cord, and 1 anterior division forms the medial cord. In generally, anterior division of trunks innervates the flexus muscles, which lies in front of bone of the upper limb, and posterior division of trunks innervates the extensors muscles, which lies behind the bone of the upper limb. Lateral, medial and posterior from the axillary artery, we have lateral, medial and posterior cords. The cords are formed as follows. The anterior division of the upper and middle trunks unite to form the lateral cord, and the anterior division of the lower trunk continues at the medial cord. The posterior divisions of the 3 trunks unite to form the posterior cord. Lateral cord branch is lateral pectoral nerve. It passes across the axillary artery and vein, pierces the clavipectoral fascia, and enters the deep surface of the pectoralis major to innervate it. Posterior cord branches are upper and lower subscapular nerves. These 2 branches innervating the subscapularis muscle and teres major muscle. The third branch of posterior cord is thoracodorsal nerve, which travels with the thoracodorsal vessels on the lateral side of the scapula and innervates the latissimus dorsi. The medial cord branch is medial pectoral nerve, which emerges from the clavipectoral triangle, and innervates the pectoralis major muscle and pectoralis minor muscle. The nerves of the infraclavicular part of the brachial plexus emerge from the cords. The cords give both mixed and purely sensory branches which innervate the entire upper extremity. The cords split into 7 terminal branches. The axillary nerve and the radial nerve arise from the posterior cord. The musculocutaneous nerve and lateral root of median nerve arise from the lateral cord. The ulnar nerve, medial root of median nerve, medial cutaneous nerve of forearm, and medial cutaneous nerve of arm arise from the medial cord. The medial and the lateral cords give off the medial and lateral roots of the median nerve, which fuse to form the median nerve. Formation which look like letter M form lateral musculocutaneous nerve, median, lateral and medial root of the median nerve, and medial ulnar nerve. We can repeat now that the brachial plexus consists of 5 roots, 3 trunks, 6 divisions, 3 cords, and 7 terminal branches. The nerves innervating the muscles of the anterior side of the arm, forearm, and hand originate from the anterior branches of the brachial plexus, from the medial and lateral cords. The posterior groups of the arm and forearm are innervated by the radial nerve, and the shoulder region are innervated by the axillary nerve. They are the branches of the posterior cord. The axillary nerve is formed within the axilla region. It is a direct continuation of the posterior cord of the brachial plexus. Immediately after its formation, the axillary nerve lies posteriorly to the axillary artery and anteriorly to the subscapularis muscle. It descends to the inferior border of the subscapularis muscle and then exits the axilla posteriorly across the quadrangular space. It is accompanied by the posterior circumflex humeral artery. In the posterior scapular region, the axillary nerve terminates by dividing into 2 branches, anterior and posterior. Anterior terminal branch provides motor innervation to the deltoid muscle. Posterior terminal branch provides motor innervation to the teres minor muscle and innervates the skin over the inferior part of the deltoid. The axillary nerve also provides articular branches to the shoulder joint. The branches of axillary nerve innervates the deltoid muscle, teres minor muscle, and skin over the deltoid. This is the lateral cutaneous nerve of arm. The axillary nerve is at risk of damage in inferior dislocation of the head of humerus from shoulder joint and in fractures of the surgical neck of the humerus because of its close relation to these structures. The radial nerve is a continuation of the posterior cord of the brachial plexus. The nerve arises in the axilla region, where it is situated posteriorly to the axillary artery. It exits the axilla inferiorly across the triangular space and supplies branches to the long and medial heads of the triceps. The radial nerve then descends down the arm, traveling in the shallow depression within the posterior surface of the shaft of the humerus, known as the radial groove. As it descends, the radial nerve wraps around the humerus laterally and supplies a branch to the lateral head of the triceps. During much of its course within the upper arm, it is accompanied by the deep branch of the brachial artery. To enter the forearm, the radial nerve moves anteriorly over the lateral epicondyle of the humerus through the cubital fossa. The nerve then terminates by dividing into 2 branches, deep and superficial. Deep branch or motor branch innervates all the muscles of the posterior compartment of the arm and forearm. Superficial branch or sensory branch contributes to the cutaneous innervation of the hand and fingers. Cutaneous branches of radial nerve innervates skin of posterior aspect of the upper arm, it is the posterior cutaneous nerve of the arm, and the skin of the posterior aspect of the forearm, it is the posterior cutaneous nerve of the forearm. In the hand, the skin of the lateral 2.5 digits on the dorsal surface as far as the distal interphalangeal joints. Branches of the radial nerve innervates the triceps and skin over the triceps, forearm extensors and skin over the forearm extensors, and skin over the first, second, and third finger on the dorsal side of the hand. The musculocutaneous nerve arises from the lateral cord of the brachial plexus. After originating from the brachial plexus, the musculocutaneous nerve leaves the axilla and pierces the coracobrachialis muscle near its point of insertion on the humerus. It then passes down the arm, anterior to the brachialis muscle, but deep to the biceps, innervating them both. The musculocutaneous nerve emerges laterally to the biceps tendon and continues into the forearm as the lateral cutaneous nerve. It provides sensory innervation to the lateral aspect of the forearm. Here, with musculocutaneous nerve, we have one specific situation in the arm. The musculocutaneous nerve descends and perforates the coracobrachialis muscle and splits into the muscular branches which innervates the coracobrachialis, biceps, and the brachialis. After that, descend into the forearm and give us a lateral cutaneous nerve of forearm which innervates skin over the lateral region of the forearm. Only the median nerve arises from the lateral root of lateral cord and medial root of medial cord of the brachial plexus in axilla. It is closely related to the brachial artery throughout its course in the arm. It is superficially located, except at elbow, where it is crossed by the bicipital aponeurosis. The relationship of median nerve with the brachial artery in the arm is, first, in the upper part, it is lateral to the artery. Second, in the middle part, it crosses in front of the artery from lateral to medial side. Third, in the lower part, it is medial to the brachial artery up to elbow. In the forearm, the nerve travels between the flexor digitorum superficialis and flexor digitorum profundus muscles. The median nerve gives rise to two major branches in the forearm: anterior interosseous nerve and palmar cutaneous nerve. Anterior interosseous nerve supplies the deep muscles in the anterior forearm, except flexor carpi ulnaris and the ulnar half of the flexor digitorum profundus. Palmar cutaneous nerve innervates the skin of the lateral palm. The median nerve enters the hand across the carpal tunnel, where it terminates by dividing into two branches: recurrent branch and palmar digital branch. Recurrent branch innervates the thenar muscles, except adductor pollicis. Palmar digital branch innervates the palmar surface and fingertips of the lateral 3.5 digits, and same digit distal to the proximal interphalangeal joints on the dorsal side of the hand. Also innervates two lateral, first and second, lumbrical muscles. Muscular branches of the median nerve innervates the forearm flexors, except flexor carpi ulnaris and medial half of the tendon of the flexor digitorum profundus. Innervates the thenar muscles, except the adductor pollicis, and innervates the first and second lumbrical muscles. Cutaneous branches innervates the palmar surface and fingertips of the lateral 3.5 digits, and same digits distal to the proximal interphalangeal joints on the dorsal side of the hand. The ulnar nerve is derived from the brachial plexus and it is a continuation of the medial cord. After arising from the brachial plexus, the ulnar nerve descends down the medial side of the upper arm. At the elbow, it passes posterior to the medial epicondyle of humerus, entering the forearm. At the medial epicondyle of humerus, the nerve is easily palpable and vulnerable to injury. In the forearm, the ulnar nerve travels between two heads of the flexor carpi ulnaris and alongside the ulna. Three branches arise in the forearm: muscular branch, palmar cutaneous branch, and dorsal cutaneous branch. Muscular branch innervates flexor carpi ulnaris and the ulnar half of the flexor digitorum profundus. Palmar cutaneous branch innervates the skin of the medial half of the palm. Dorsal cutaneous branch innervates the skin of the medial 1½ fingers and the associate palm area. At the wrist, the ulnar nerve travels superficially to the flexor retinaculum. It enters the hand across the ulnar canal. In the hand, the nerve terminates by giving rise to superficial and deep branches. In general, ulnar nerve innervates in the hand the hypotenar muscles, all the interossae, third and fourth lumbricals muscles, and intenar adductor pollicis muscle. Innervates skin of the medial 1½ digits on the palmar surface, and the medial 2½ digits as far as the distal interphalangeal joint. We shall repeat now that the branches of the ulnar nerve innervates the flexor carpi ulnaris and the ulnar half of the flexor digitorum profundus, the hypotenar muscles, all the interosseous muscles, and third and fourth lumbricals muscles, and intenar adductor pollicis muscle. The cutaneous branches innervate the skin of the medial 1½ digits on the palmar surface, and the medial 2½ digits as far as the distal interphalangeal joints. The terminal branches of the medial cord are ulnar nerve, medial root of the median nerve, and medial cutaneous nerve of the arm and forearm. The medial cutaneous nerve of the arm innervates the skin in the median region of the arm. Medial cutaneous nerve of the forearm innervates the skin in the medial region of the forearm. We shall repeat now the innervation of the palmar and dorsal surface on the hand. The median, ulnar, and radial nerve innervate the skin over the hand. On the palmar surface, we have median and ulnar nerves. On the dorsal surface, we have median, ulnar, and radial nerves. Median nerve with the palmar digital branch innervates the palmar surface and fingertips of the lateral 3½ digits, and the same digit distal to the proximal interphalangeal joint on the dorsal side of the hand. Ulnar nerve innervates with palmar cutaneous branch the skin of the medial half of the palm. Dorsal cutaneous branch innervates the skin of the medial 1½ fingers and the associated palm area. Radial nerve innervates in the hand the skin of the lateral 2½ digits on the dorsal surface as far as the distal interphalangeal joints. The lesions of median nerve may occur at the following 4 sites: at elbow, at mid-forearm, at wrist or distal forearm, and in the carpal tunnel. Ape hand is a condition in which movements of the thumb are severely limited. The thumb may have limited extension and flexion. This means the thumb can only be moved away from and towards the hand in the plane of the palm. The thumb will also have very limited or no ability to abduct or oppose. Benediction deformity of the hand is a condition when patient tries to make fist. The index and middle fingers remain straight due to paralysis of both superficial and deep flexors of these fingers, leading to loss of flexion at proximal and distal interphalangeal joints. The ring and the little finger can be kept in the flexed position due to intact nerve supply of median half. An ulnar claw, also known as claw hand, is a deformity of the hand that develops due to ulnar nerve damage causing paralysis of the lumbricals. A claw hand presents with the hyperextensions at the metacarpophalangeal joints and flexion at the proximal and distal interphalangeal joints of the fourth and fifth fingers. The patients with this condition can make a full fist, but when they extend their fingers, the hand posture is referred to as claw hand. The ring and little finger can usually not fully extend at the proximal interphalangeal joint. This can be commonly confused with the hand of benediction or Pope's blessing, which is caused by proximal, at elbow level, median nerve damage. The radial nerve is responsible for innervating the extensor muscles of the wrist and digits. Injury to the radial nerve results in the inability to properly utilize these extensor muscles. The wrist and the fingers cannot extend at the metacarpophalangeal joints. As a result, the hand hangs flexibly in a position of flexion when the patient attempts to bring the arm to a horizontal position. This is known as wrist drop. You can see here the major arteries of the upper limb, superficial veins of the upper limb, and brachial plexus and the branches of the brachial plexus. Also, you can repeat here the origins and insertions of the muscles of the anterior compartment of the arm and anterior compartment of the forearm. For me, this is the excellent picture because in one place you can repeat all root, trunk, divisions and cords of the brachial plexus, all branches and terminal branches of the brachial plexus. You can repeat muscular and cutaneous branches of the musculocutaneous nerve, median nerve, ulnar nerve, radial and axillary nerves. That's all for today. If you have questions, you can send me by email.